Good morning, good afternoon, all. Thank you for joining us today. My name is Rebecca Mannerley. I am a policy advisor for infectious disease at the Wellcome Trust, and I'll be your moderator for today's webinar. So today we're going to be discussing the Independent Panel on Evidence for Action Against AMR, the IPEA. At the UN General Assembly last year on AMR, country representatives called for its creation to provide countries with the best possible evidence and guidance on how to effectively address AMR. Despite posing an increasingly significant risk to human life, AMR has historically struggled to achieve the political prioritization it warrants. The IPEA will create a hub for AMR evidence that can provide countries with the insight needed to guide their activity, whilst also ensuring researchers are generating the evidence that will guide action. The process to establish the IPEA is currently underway, led by the Quadripartite. And just to say, today's session is not an official part of this consultation, but rather is an information session brought to you by ESCMID and the Global Strategy Lab, intended to explore the benefits of the IPEA, what types of scientific input will be critical to its success, and to offer guidance on how researchers can participate in the ongoing consultation. We will have a series of presentations today, followed by a moderated Q&A session. You will see at the bottom of your screen, there is a Q&A button there. Please do feel free to send in those questions and we will get to them at the end after the presentations. Now to just briefly introduce our panelists. Firstly, we have Professor Mike Sharland. He leads the Antibiotic Policy Group at City St George's University, London, and is the International Officer of the ESCMID AMR Action Committee. As a leading global expert in antibiotic use and policy, he advises the WHO on optimal antibiotic use and is the former chair of the Antibiotic Working Group of the Essential Medicines List, which developed the Access Wash Reserve, the AWARE system for antibiotics. Next, we have Dr. Mathieu Poirier, who is the director of the Global Strategy Lab and the scientific director of the AMR Policy Accelerator and York Research Chair in Global Health Equity. He is also Assistant Professor of Social Epidemiology at the School of Global Health at York University and is Director of the WHO Collaborating Centre on the Global Governance of Antimicrobial Resistance. Next, we have Dr. Jyoti Joshi, who has over 20 years' experience working on maternal and child health, public health policy, and immunisation and vaccine safety in Asia. Her role in the International Centre for Antimicrobial Resistance Solutions, ICARS, she works with partner ministries to ensure that actions to tackle AMR are tailored to local contexts and effectively implemented. We also have Dr. Anna Matthias joining us. She has held the role of scientific coordinator at the Antimicrobial Resistance and Veterinary Products Department of the World Organization for Animal Health since October 2021. She is a veterinarian, a diplomat of the European College of Veterinary Public Health, and a former senior lecturer at the Royal Veterinary College in the UK. We also have Dr. Zhang-Yon Wang, who is an environmental chemist with the United Nations Environmental Programme. His work studies the risks of anthropogenic chemicals in both the technosphere and the natural environment, and he was also recently involved in the establishment of the Intergovernmental Science Policy Panel on Chemicals, Waste and Pollution. We also have Professor Iruka Okeke joining us, who is a professor of pharmaceutical microbiology at the University of, in Nigeria. Her research focuses on using microbiology, genetics, and genomics to understand how bacteria colonize humans, cause disease, and develop drug resistance. Please do feel free to introduce yourselves in the chat as we go through the presentations, and we will jump into the first presentation from Matteo, who will be exploring the benefits of the IPEA and the key design considerations that will be needed for its success.
All right, thank you very much for that kind introduction, Rebecca. I'm going to be sharing my screen. All right. I am Mathieu Poirier, again, Director of the Global Strategy Lab based at York University in Toronto, Canada. I'll be covering information from a systematic scoping review that we conducted titled Science Policy Interfaces in Global Environmental Governance, Policy Lessons and Trade-offs for the IPEA. Apologies, I get set up here. All right. We'll be providing hopefully a link to this piece in the chat and providing a copy after the webinar is over. And I just have time to cover three gaps in global AMR governance that we hope will be addressed by IPEA. And I'm going to start off with a very straightforward one, hopefully not controversial at all. There needs to be better evidence. There's a lack of context-specific evidence on the effectiveness of AMR interventions. Now, in terms of how the panel might fit in here, we're going to need to synthesize the multi-sectoral and interdisciplinary evidence needed to help countries prioritize effective AMR policies. And I want to highlight that this is not just about producing good science. This is about producing good science with policy relevance. And both of those are going to be key for IPEA to succeed. I'm going to be covering just takeaways from the systematic scoping review. Again, quite uncontroversial here. We need to have a methodological rigor, contestability, accountability, transparency built into the processes, these scientific processes, and it should be multidisciplinary. We've seen from the zero draft that this is directly acknowledged. The need to include agri-food, animal health, environment, and human health sectors, as well as social sciences and economic science in these interdisciplinary panels. Just as important will be the need to align science with policy needs, right? We're not just producing science and throwing it out into the ether. We need to be aligned with the needs of policymakers. And so we're going to need to have some form of science policy dialogue, real-time knowledge translation, and iterative and inclusive stakeholder engagement. There's also been a discussion as to whether this panel would simply have an evidence synthesis function or whether there's a role for a limited set of primary research functions. So some ideas have been put forward, such as cost effectiveness analyses, which are key for motivating investments in WASH, health system strengthening, and vaccination, potentially for modeling to estimate the likelihood of achieving targets and even seeing the potential outcomes of policies. And even multi-site trials. There's an efficiency advantage of international coordination of trials in different countries. And there's some early indication from the zero draft that some of these primary research functions might be available in the form of horizon scanning, different forms of assessments, and direct policy support. So evidence, one key for the panel. Now, going on to another gap in governance, and is that of equity. There's a mismatch between AMR science infrastructure and the need for better evidence and interventions. This needs to be met by promoting Global South leadership in AMR knowledge production and priority setting to create legitimacy and relevance. This needs to be a globally relevant panel for it to succeed. And now, how do we actually achieve that? From the literature, there are both equitable practices and the need for capacity strengthening. So in terms of practices, there should be regional, gender, disciplinary quotas across the governance body, expert panel, and working groups. And we have indeed seen this recognition of the need for geographical and gender representation in the zero draft. Capacity strengthening is another key part, though. In UNEP's International Resource Panel, there's funding provided for members from developing countries to attend meetings. From IPEA's fellowship program, there's a mentorship program for early career researchers, and again, covering meeting expenses for fellows from developing countries. In the zero draft for IPEA, we've seen the recognition of the need for assessment of evidence with focus on areas with high impacts from AMR, including low and middle income countries. It's going to be just as important to support representation from the Global South across all of these different bodies. And lastly, in terms of equity, the actual scientific process, how do we balance legitimacy with efficiency? There's a light touch model going after the IPCC, where there's a public feedback loop that allows policymakers and non-state actors to deliberate and comment on draft reports. Or there's a deeper engagement, the IPBES model, where there's a co-production of research and policy priorities with policymakers and non-state actors through structured engagement. It seems like from the zero draft that we're including observers in the plenary, including indigenous peoples, local communities, groups in vulnerable situations, and coordinating closely with MSPP, so potentially leaning more towards the IPCC model. And going right into the third key aspect here, and that is of salience. We do recognize as an AMR science community that we are in many instances failing to reach high-level decision makers and the public. And to meet this gap, we need to actually raise the salience of AMR as an issue. This could be achieved through independent progress tracking and communication to shape news cycles and create political rewards. I really want to emphasize that if we create good science that doesn't reach the right people, that doesn't break into news cycles, this panel will not be as successful as it could be. There's a reason why when you go to the dinner table, everyone knows the goal to hold the increase in global average temperature to well below 2 degrees centigrade above pre-industrial levels, this global warming goal, because goals are powerful tools that can guide action towards relevant activities and motivate persistence. Even the political process of developing the goal can help to shape our collective ambition as a group. And in a similar way, IPEA can serve as an objective arbiter of progress in meeting global goals. Now, in the zero draft, there is a recognition of the need to raise public awareness. So it seems like there might be some space for this role of raising the salience of the issue overall. And finally, I really want to emphasize that knowledge translation, communication is going to be key to success. There needs to be a variety of outputs we've seen from the synthesis reports, assessment reports, policy briefs, and many more. There needs to be a dedicated knowledge translation unit that can translate complex scientific findings into clear, actionable, and policy relevant insights. And in fact, this has been recognized in the zero draft that the Secretariat is needed to disseminate the panel's deliverables and produce a variety of communications materials. And lastly, we're going to need to find that balance between being policy relevant, but not policy prescriptive. But that is something we'll have to figure out in the years to come. So that is all the time I have today. Thank you for the time.
Thank you, Matteo. And to move straight on to the next presentation, we have JT, who will be presenting on what countries need from the IPEA and what scientific outputs will be helpful at country level. Over to you.
Sorry, am I audible now? Yeah. Thank you, Rebecca. So I'll just keep it brief and to the point here. Before I start, I would like to clarify I am an independent consultant with the International Center for AMR Solutions. These reflections and thoughts are my own, though they are also stemming from the work that we do at ICARS. So AMR, as we know, is a critical global health, and not just a health, but a development challenge. And the highest burden that is faced today in all the One Health sectors is in the low and middle income countries. The talk I'm going to give is more focused on the feedback that low middle income countries need to have, and looking at it from a One Health perspective, like Matthew explained about antibiotics being used in human health, also for animal production, and then reaching the environment, which acts as the reservoir. So what do countries want from this independent panel? Basically, what we reflect back and see at the country level work that we are doing, there needs to be shared values and purpose between science and policy. That means the scientists who are working and informing the scientific evidence based, as well as the policymakers that determine the regulations and implementation aspects of action, need to work in tandem. And so, first of all, this needs validation, which includes the exact drivers of AMR. The previous panelists mentioned these drivers of AMR of both One Health perspective are very context specific. And that's what we find in our work. Sometimes there's lack of evidence or there is limited evidence, which cannot always be translated from one context to the other. Each of the sectors are in different phases of maturity. So their sectoral priority setting is something that requires more evidence base to come from those local contexts. And last but not the least, even for this validation, there is a need for integrated follow-up by all these sectors coming together, even if they're in different levels of socioeconomic development. This validation needs to be then followed by dialogue, where the locally relevant solutions that come up from the ground need to be designed and by brainstorming, talking, looking at the facts, and then being designed in an affordable, equitable, and inclusive manner. There is good evidence coming from the current recommendations, as Matthew mentioned, about remote locations and marginalized communities being included. But these variations are also very country specific, and so policymakers need to know, based on the evidence published by the scientists, of what this inclusivity means. This is important to design what we need to finally achieve. But then, if we don't do anything, what is that cost of inaction? So, costs become very important in any context, whether it's high or low middle income countries. Subsequently, I would say co-creation. We have talked about a lot about co-creation, and in ICARS, we do a lot of implementation research, which is working with the researchers and policymakers on the ground to create solutions that work for their context, whether it's socioeconomic, development, geographical locations, etc. Eventually, there needs to be a menu of options that countries can choose from that based on the local context and act upon them to try and pilot them for impact. All of this requires behavior change, and this behavior change options also are locally driven. So, talking to communities in fostering those dialogues and creating those solutions for pilot is the need of the hour. Last but not the least, scientists need to get into partnership with policymakers to design policies that are AMR sensitive, but also cognizant of the other challenges that the countries faced. These need to be sectorally specific, but need to be evaluated and have feedback on how relevant they stay based on an assessment which is done on a regular basis. Coming back to my second question in the session was about what scientific outputs would be helpful at country level. Definitely, first, they have to be technical solutions. And these are not just from human health or a science perspective, but also from technology, which is digital or manual, and engineering or remodeling based. So these solutions have to be designed by local scientists together with the international scientists. Geographical variations that exist on AMR, whether it's rural, urban, or coastal locations, etc. The interplay of AMR with other drivers that the policymakers are juggling is also important for scientists to recognize and come up with solutions that can work. And last but not the least, redesigning foods and waste management systems so that they are relevant for the context and do not limit development, which each country is trying to seek. We also need economic data from scientists that are working in this stream. We need behavioral research, which will incentivize behaviors based on local context, because antimicrobials are used as stopgap solutions for interventions that need long-term inputs like water and sanitation or etc. Environmental solutions, since environment is a big reservoir and low middle income countries are the ones that have the poor wash and water services. This is something that the low and middle income countries need to focus on and could be low hanging fruits that are developed tailored to the solutions. And last but not the least, community-based research that informs both the formal providers for healthcare, but also the informal healthcare providers in human health as well as animal production services, because agriculture is both large field-based intensive agriculture, but small backyard farming. Most of all, I would say these need to be integrated from a One Health perspective. One Health is still a tool that needs to grow from the theory to the practical purposes. But we must remember that all of these interventions need to be designed by scientists taking a whole of society approach and informing policymakers to go up from an individual level to the family, town, or province and the national level. And this is what climate change has been able to achieve. And this is where we need to get there if we need to tackle AMR successfully. Thank you, and I will end the talk here. Thanks a lot.
Thank you, Jyoti. Next up, we have Mike, who will be reflecting on the IPEA science working groups and the role of different expert groups in shaping the work of the IPEA's scientific assessment. Over to you, Mike.
Thank you very much indeed. And you can see my screen, and I'll do that as well. Hopefully you can you see my screen now? And I'm going to swap displays and that will work. Yep. Is that okay? Splendid. Okay, so thank you very much indeed for asking me to talk today. So, as discussed, I'm also presenting this on a personal basis. I'm the International Officer for ESMID, the AMR Action Subcommittee. So, there have been quite a lot of recent IPEA discussion documents about this future science panel, which have been quite striking because there hasn't really been very much discussion on the science and how that's going to be organized and sort of structured. There's some helpful work, I think, from Maruka out of the recent Lagos workshop that you may wish to talk about. But actually, on the whole, there hasn't been a lot of discussion about what are the optimal methods for defining and answering the key questions in AMR science. And obviously, we know structure influences outcomes, quality, relevance, and usability of the outputs, as Matthew has been sort of talking about. We have got a little bit more information of the interdisciplinary expert committee of the draft, which in fact is going to have 6 experts representing all the quadripartite sectors, as well as economic and social science, and interestingly nominated by the quadripartite organizations. Given all of the expectation upon those 6 experts, it looks like they're going to be quite busy people. So what are the scientific experts that might like to be involved on this? Well, there's a rather lot. And there's all sorts of different speciality and different expert groups, so the globally and many others that will wish to have a voice within the independent panel. So therefore, there's a fairly urgent need to try and work out what we're going to do in terms of the panel, sort of the structure and organization. Other independent panels have a reasonably well-established scientific process now, obviously IPCC with its classic 3 working groups, what is climate change, trends and risks, impacts, and then the interventions. IPBES, as discussed, has a very interesting component about assessing non-scientific knowledge, particularly ethnographic insights and the lived experience, which of course is very relevant, to AMR. And so what might this look like? What could the work plan look like, and what could the sort of kind of research questions that drive the panel look like? This is just a personal view, so maybe an expert group 1 could sort of think about assessing the trends, drivers, and risks of AMR and AMU. Actually, not entirely clear what we're talking about now. Is it just bacteria, viruses, fungi, protozoa, TB? This probably needs to be sorted out relatively soon. We could think about aiming to determine the sort of what are those relevant to the quadripartite sectors. And actually, obviously, we would need to think about cross-sectoral dynamics because those are what will inform sector-specific interventions. The evidence will need to be reviewed for different biological mechanisms, evolutionary versus ecological, and also AMU is a key driver of AMU, and summarize, of course, the past and future trends, and as discussed, the potential emerging risks. So the research questions might look like, what are the key patterns of AMR and AMU relevant to sort of human, animal, food, and agriculture, environmental health, and the past and future trends and key risks. And then actually more importantly, sort of kind of what are the dominant transmission pathways, the sort of the biological mechanisms that drive cross-sectoral spread of AMR, and how do these pathways vary across the different One Health compartments, and particularly geographic and epidemiological contexts. Another expert group, 2, for example, might want to assess the quadripartite health and socioeconomic impact of AMR. That would be a fairly classical approach of doing that, and AMU trends, and particularly trying to think about, the impact of other demographic trends, but climate change and other major external threats. So, questions could look like, what are the national, global health and sort of socioeconomic impacts of this current projected AMR trends across the One Health sectors? And actually, how will these major external global drivers then impact on these future trends, at national and global levels? And particular key focus, for the panel has been what are sustainable levels of global antibiotic use? If they keep going up, then when do we reach when do we reach a tipping point? What are those sustainable levels? Another working group 3, for example, might then wish to assess the interventions to adapt or mitigate to AMR. Clearly, there must be a strong focus not to prevention, IPC, vaccines, hospital hygiene and wash, as others have talked about, and also optimal treatment, antimicrobial policy, novel therapeutics, diagnostics, optimal use strategies, and stewardship. But I think the critical component around this is actually going to be assessing, in this very difficult times, the relative cost effectiveness and impact of these different interventions at national and global level. And this will be one of the focuses, strong focus of the ESMID AMR sort of Science Policy Forum that will be held in next April in Munich. And I think there needs to be really good thought about the robust methods to estimate the strength of evidence and levels of confidence in this evidence base. So the question would be, what is the relative impact, cost effectiveness, barriers and enablers of defining all these different optimal prevention and treatment strategies? And then how can the strength of evidence and level of confidence be systematically assessed and then really communicate? There's a lot about communication to try and inform prioritization and policy decision making. So, the outputs I won't go through, and I think some of those are in the zero draft at the moment. But, the action-orientated outputs, as been discussed previously in Jyoti, it's about how to do it. The panel needs to be practical about sort of kind of how to do it. So just to end the discussions, really, I think we can take forward in the chat is really talking about, how can we mix both this panel to be ambitious, but also realistic? There is a limited time to get on, and what do we do about topic setting and prioritization? This is a complex area. One possibility, for example, is to focus on the commitments in UNGA 2024, which, did provide commitments and tell you, asking about what countries and others can do, but don't inform countries very much about how to do that. And that could be a very good role of the panel. I think, as we discussed before, is the organisation of work plans of these ad hoc working groups, because it's the ad hoc working groups that will do the work. And so they are critical in terms of actually making sure they have a transparent methodology. In other independent panels, in fact, there's a lot of discussion about not doing new work, but actually doing existing work. But as Matthew was discussing, evidence synthesis is a lot of work. It's very complicated and time-consuming work. And, there will need to be technical support units that do this. And, some of those technical support units will have a lot of work to do as well. There's thinking about realistic timescales. How will these work? Can you do overlapping of different work plans? And as far as possible, much of this should be parallel, really, to try and get through the work in the time, particularly trying to get realistic, good quality outputs within the sort of 5 years. So the next step, really, just to finish, I think, is engaging leading global scientists. The independent panel has, now to rapidly move on from the really important governance components to think about how we can get all the global scientists signed up to engage within this, given that many of them will be taking forward voluntary contributions. As we know from the independent climate change, 600, 700, 800 scientists, really give a vast amount of their times, to take forward in that. And that really includes geographic representation, as discussed with funding for low and middle income settings. This will require a long, broad collaborative efforts from scientists for many years, and ESMID is really keen to try and play a major role in trying to help and start mobilizing scientists to get behind the panel and start to sort of move on with the actual work. Thank you very much.
Thank you very much, Mike. And for our final presentation, we are going to be hearing from Anna on the consultation process for the IPEA.
Okay, can you see my presentation, please? Yes, perfect. Thank you so much. I think I'm going to try and keep it short because the other speakers have done such a great job. And so my name is Anna Mateus, and I'll be presenting on behalf of the Quadripartite organizations today. So as you know, we were invited to the Quadripartite was invited to set up the IPEA. So here we have the reasoning is that the four organizations can work together to ensure that we have a transparent mechanism in which we will set up the IPEA through surveys and consultations with relevant stakeholders, including the scientific community. And what we want is to ensure that we have good quality evidence that will support countries when developing informed decision makers for tackling AMR. So what is important to have here for having a strong panel? We have to have a founding document that will set up the governance structure of the independent panel. First and foremost, we have to have very clear scope, objectives, and functions. We also have to see how we'll be functioning in terms of institutional arrangements, what will be the financial mechanisms to support it, and also what kind of partnerships. So we have to make sure that we don't have conflict of interest, and the partnerships exist with different types of organizations, might they be international, regional, or national organizations. And these will be set up when the IPEA is launched in December this year. The other thing that we also need is how, and this is I can see that many of the panelists are also concerned about this and also raise the awareness that how will the independent panel work? So first and foremost, this consultation that we're going to run in September will inform the procedures as well. So it will not only be for the founding document, but we'll also be wanting to hear from scientific community on how you want to run. So this will cover, for instance, rules of procedure, the conflicts of interest, how do we dealt with, and also how do we set up the work plan. But of course, it's very important is how we will be engaging the scientific community in generating the evidence, for instance, for ensuring that the panel can have their deliverables from the work plan. So therefore, this might be, for instance, as previously mentioned, setting up ad hoc groups. They're very important for the works of many of our organizations, as we know. So we plan that this will be ready by the plenary session. But it's important that you realize that all of these two documents, the founding document and the series of documents that will set up the rules and procedures of the IPEA, will also be dynamic documents. So they will not be set in stone, and they will evolve as the independent panel evolves. So some of the functions were already mentioned here from Mike, so I'm not going to expand here, but one thing that the panel will not be doing is doing capacity building. It's not we don't think it will be within the scope of the independent panel, but it will be mainly, and will not be generating evidence. That's really the function of the scientific community, and that's why we want to work closely together with you. So the thing is, the panel role will be mainly on assessing the quality of the evidence, identifying new risks for which we need to consider where, for instance, financing should be put or research should be prioritized towards to, and also identifying gaps in knowledge that then can also help set up research agendas for countries, regions, and also a global level. And of course, we also want to see how we can support then policymakers by all the analyses and all the scientific opinions that might derive from this panel, how this then will help develop new methodologies and tools to support decision-making. So this is probably the most important slide that I have, which is the whole process on how the IPEA will be set. So it started with the landscape analysis. As you mentioned before, Mathieu had a very good presentation on what the mapping of the different types of independent panels, and Mike as well. And also we have been doing stakeholder mapping, because we want to see that we identify all the relevant stakeholders that need to be involved. And we, of course, we already have done a survey to support what people expect, what the different stakeholders expect from the IPEA. And this has led to the draft 0 of the founding document. There's now going up for consultation on the 8th and the 9th. So we really would like you to participate in this consultation if you can. If you cannot participate in the webinars, you can always give us the feedback written until the 22nd of September. And then from here, we will start working on the rules and operations document. Now, the launch of the founding document will be in December. So on the 10th of December, during the United Nations Environment Assembly, the IPEA will be launched. And then on Q1, the first trimester of 2026, we'll have the first plenary of the IPEA, where then there'll be the adoption of the rules and operations documents. So we really are counting on your participation. So how can scientists be part of this process? So scientists can be involved either directly, so for instance, by raising awareness of the panel and also diffusing it for your peers and networks, but also engaging with focal points that be involved in the panel, and also with observers, because observers, we are proposing that they could also provide input, but of course, they might not be involved in decision-making, but this is all still in the air. As we go on the consultation, this might still change. And we want as well that they might be able to participate in the meetings of the plenary of the governing body of the IPEA. So for instance, might be observers, or they might be part of the other groups or the interdisciplinary expert committee. As you know, there's only 6 members, so that might be more complicated, but that doesn't mean there might be, I can see Mike smiling, so there might be opportunities for being part of the other group. So that's different roles that you can fulfill. And of course, you can be involved in reviewing the data generated from the independent panel, or even contributing with data for the experts that are conducting the evaluation of the evidence. Indirectly, you can also be involved in your role as researchers by publishing evidence on AMR as a part of your day-to-day work. You can also be doing, for instance, special issues on, for instance, as topics that you think that the panel should be aware of, and you should be raising their attention towards to, or hosting workshops like this, or the webinars like this, where you actually raise awareness for the issues that the panel should be aware of. And of course, you can also be addressing knowledge gaps that might be available on the scientific opinions of the panel, and also disseminating or doing capacity building activities based on the recommendations from the panel. So there's a lot of scope and a lot of ways in which you can participate. These ways of engagement are not set on stone. So please, if you want to participate in the upcoming webinars, then you can be able to, if I miss anything that I haven't talked about that you would like to be brought to the attention of the core group for the Quadripartite working on this, please participate in this work, in these consultations, because it will really help us to have your opinion so we can consider all the options on how we can engage the scientific community. And I'll stop there. Thank you.
Thank you very much, Anna, and thank you to all of our presenters for their insights. Before we move on to the Q&A, I'd just like to invite Taruka to provide any comments and observations she has.
Thank you, Rebecca, and thanks a lot to the speakers. I think we had a really nice overview of the process towards the panel and the potential that the panel brings. I think this panel is going to be very important to all of us that are scientists, and in particular to scientists and members of the public that live in lower middle income countries where there is less evidence. And as Matthew mentioned, a lot of the evidence is not policy relevant. So, I mean, this panel was called by UNGA to essentially help to not only have the evidence curated, but also identify gaps. So I just want to bring out a few of the points that the speakers made that are particularly relevant to scientists that want to weigh in to the work of the panel. I think multiple people spoke about, particularly Matthew and Joycey, the issue of equity, which I've alluded to already, and also the importance of communication. It would be really sad to set up another AMR organization that only we that are scientists know about. And so it's going to be very, very important for the panel to have multiple modes of communicating that capture audiences that previously have been completely unaware of antimicrobial resistance. Really want to thank not just the organizers of this program, but of all other initiatives that have brought people together to talk about the panel along the roadmap that the Quadripartite is asking for, and also the Quadripartite for continuing to ask for input. What we find, if you look in the literature, is that it's actually been documented that there are epistemic injustices when it comes to AMR and people being able to feed in. They're loud voices that are often heard, and they're actually voices that should be heard that are either quiet or mute because perhaps people think they don't have permission to talk, or because they just can't find their way into the venues. And I'd really like to encourage everyone who's on this call and the people who are not on this call to think about how they can weigh into the design of the panel, which is what we're talking about now, as well as the workings of the panel when it starts work from the end of this year. one of the things that Jyoti mentioned in particular is the importance of partnership. And I think we have to think not just about partnerships that are among people in high-income countries or between high-income countries and low-income countries, but we need a lot more partnerships among different countries that have different AMR challenges. And I think it's going to be very, very important to build some of these South-South connections when the panel begins its work. As Mike correctly mentioned, a lot of what the panel is supposed to be doing is scientific, and a lot of the stuff that is out there now in the public space is all about governance. So we're really looking to, I think the Quadripartite would be looking to have a lot of scientists join the sessions that are planned for the 8th and 9th of September to weigh in on content. And it's very important. I mean, as Mike alluded to, we had a workshop in Lagos that actually brought a number of people to the table, including scientists and majority of people from low and middle income countries. And it was agreed that, look, we have to be very careful to make sure that this panel is indeed One Health, because what typically happens is that you have a lot more discourse around human health. And also, there was some interest, actually a lot of interest, in ensuring that this panel does not just focus on bacteria that can be grown aerobically, that we bring in the fungi. There was interest in even having the malaria, the TB, the viruses, antimicrobial resistance in areas that have previously been siloed. So I think we can learn a lot from different areas of science and policy that would help us really be able to address antimicrobial resistance. One issue that was brought up by multiple speakers is the issue of costs and economics. It's going to be very important to have not just what we refer to as the hard sciences, but also the social sciences, behavioral science, and economic science. Very often, those of us who are trying to do little things in AMR policy, we often hit roadblocks when trying to figure out how much are different interventions actually going to cost. And so we're going to need a lot of activity there. At the Lagos meeting, it was acknowledged that there's a lot of stuff that is within the scope of this panel. And it's very important that we ensure that the panel doesn't start with everything at once. It's going to be key to start small and work well. Rigor is very important, and listening is also very important. In fact, it was said that it should be the panel should be vocal but should not be tone deaf, was I think one of the things that came out of that meeting. I'm going to close with just a few comments now so that we can have a broader panel discussion, because I think that would be very important. But I did want to emphasize what was said by the last speaker, that it's really important for scientists to weigh in. This is the only way the work of the panel will be rigorous. As Mike said, curating evidence is challenging. And so expertise is going to be very, very important, not just in curating evidence on the panel, but also reviewing and commenting on what the panel actually has to say. I'll encourage everybody who's on this call, if you haven't done so already, please read the zero draft. Please join the September consultations on that draft. And then that also, I think scientists, it doesn't end in December. I think scientists should be willing to not only weigh in on the panel's work, but also learn from the panel's work on how we can make the work that we do in AMR more policy relevant and therefore more likely to drive change in the area of AMR. Thank you.
Thank you very much, Aruka. I can see we've had some questions in through the Q&A, but maybe if I can direct the first question to you, Aruka, actually. So both you and Mike have spoken quite a bit about the need to bring science into the discussion on the panel, and that a lot of the discussions on the panel so far have focused on the policy elements that are, of course, important, but will be driven by the scientific inputs. I wonder if you had any thoughts about the role of the panel in actually shaping the AMR research ecosystem and addressing some of those kind of power imbalances that you were talking about that already exist. Oh, so you're on mute.
Sorry, yeah, thanks to the person who asked that question. I think it's a very important one. Personally, and also some of the output from the Lagos conference, it was agreed that it would be very important for the panel to identify and provide visibility to gaps, evidence gaps. And if those evidence gaps are spotlighted, it's going to be more easy. It's going to be easier for the scientific community to direct its work to those areas. It's going to be easier for people who are funding scientific research to actually make specific calls. It's going to be easy for countries because sometimes there's a gap that is filled in some countries and not in others. For countries to actually target gaps that are relevant to their own AMR condition and have them filled. So yes, absolutely. I think that the panel will have a very important role in doing this and probably will do it better than individuals or organizations that will bring more of their own biases.
Thank you. Just looking at the other questions that come in, there's one here that's about the goals that were set at UNGA 2024. Matteo, I wonder if I could ask you to kind of elaborate on what those are and also the role of the panel in setting more future goals going forward, particularly in the One Health space.
Yeah, thank you. So that's an excellent question. There were a series of goals that were established in the UNGA high-level meeting last year, and probably the most notable of which that you may know is a 10% reduction in AMR-associated deaths by 2030. Three-part answer here. One is that as excellent as their research is, there is a difference in IPEA saying we have met this goal and the independent panel for evidence against AMR saying we have met this goal. It will generate more news cycles, more political attention by elevating it to this international level. Second is, I sincerely hope that this panel will outlive a 2030 goal, that we're going to be looking well beyond 5 years. So there's going to be a need to look forward after that goal timeline. And lastly, there's also going to be a need for target setting at the national level. We're probably going to need more of a menu approach and incorporating some context relevant targets that work for a variety of settings that could be incorporated into national action plans. So those are just three immediate ways that the panel can be helpful, but there's certainly a role to be played there.
Thank you. And I think in all the presentations, it's become clear how much of a task the panel is going to have once it's established. We have a question here that's about how does the panel prioritize that activity initially? What's the low-hanging fruit that they can be working on once it is established? Mike, I wonder if you had any thoughts on that.
Thanks very much indeed, Becky. So I think this is critical because obviously, as discussed, the working groups, particularly these ad hoc working groups, will be the groups that that take forward the main function of the panel. Difficult for 6 scientists to sort of do all that, so that's going to be a sort of component to that. And those are voluntary, and it means a lot of people putting up a lot of their time. That's been happened in other scientific panels, and I'm sure the AMR scientists will be happy to do so. But the structure of those, and therefore trying to make sure that those that they have a clear terms of reference, they have very clear scientific questions, and they have a very clear scope and a very short life. So they come on, do their work, get the evidence synthesis done, and get off is actually the core to those. So that is going to be the sort of complete feature. And much of that will be, as we discussed, evidence synthesis. That probably a certain amount of modeling will be required for some of those, so that will engage the modeling. We also have to recognize that actually, climate change has a lot more people. AMR science in many areas just doesn't have that many people. I welcome most of the people I know already on this call. So it's there's not a lot of people around, and so I think we have to accept that that we don't have the depth of climate change as well, and so we have to be sort of fairly pragmatic about the sort of kind of getting the work done. And for many, and also I think we should also acknowledge that in fact there's very difficult times for global scientists. There's actually been a quite marked reduction in funding opportunities, and so I think that there is a responsibility for funders to try to help and think through what are the key science questions now, and then beginning to sort of kind of to start already to fund through some of those and think through that work that the panel's got to do, so that we're actually trying to stay ahead of the curve as well. Thank you, Becky.
Thank you, Mike. You mentioned there about climate in the IPCC. I wonder, Jan Young, if I could come to you. Obviously, you've had a role in establishing the chemical waste panel. If there are any sort of lessons learned that you've had from setting up other evidence synthesis panels about the role that scientists play in informing and even shaping the outputs of the structures.
Yeah, I think we do have accumulated a lot of very good experience with the IPCC, EBS, IRP, etc. And the scientist is always the core of these panels, as also Mike has just said. Um, and I think what is also very important is that we do have a very flexible and agile governance structure so that the panel is also future proof. And then it's also is kind of has a very inclusive process so that you can get the different perspectives and different voices heard during kind of the starting from the like the preparing the work program, the selecting the experts, developing the terms of reference and the scope of its assessment and other deliverables, and also in preparing the deliverables. And also we have learned so much from existing panels that we and also we look forward to hearing from you during the preparation of those rules and procedures documents, which will come a bit later. So also ask for your patience in setting up the panel. I think it's a very fast process in comparison to other panels. I think IPES took 5 years, or like the SPP, the Science Policy Panel on Chemicals, Waste, and Pollution, took 3 years to negotiate the founding documents. So we are in a very expedite process, and but I think we have learned so much on the way, and we also very much look forward to working with you, and also to set up to make it most helpful in the coming months. And yes, thank you.
Thank you. Perhaps if I come to you, Anna, on a little bit more about the consultation process, obviously coming from the animal health sector, it'd be interesting to hear what the considerations around bringing in this sort of cross-sectoral research element into the shaping of the panel is.
Thank you so much. So it's very important because certain sectors are not well represented in terms of equity of evidence, as has been mentioned before. And we have that, for instance, in the animal sector. We have a lack of medicines, access to medicines. We have a lack of burden of disease in animals that's due to antimicrobial resistance, and also impacting production and in food security. So that's the kind of things that we need to mention. And for instance, we tend not to speak about companion animals, and there's research out there about resistance in companion animals, but it tends not to be seen by the policymakers. So therefore, there's a lot that we need to start gathering in terms of evidence from the different areas of the animal health sector, and also how we interact with the other sectors. So that cross-sectoral research is also needed to see how AMR moves across and in between sectors. I'll stop there for my colleagues to intervene too. Thank you so much.
Thank you, Anna. I wonder if I could bring out the sort of equity point that's come across in quite a few of the presentations and quite a few of the discussion points in this Q&A section. We obviously talk about the importance of making sure that the panel is developed with equity considerations in mind, but I wonder if any of the panelists have any thoughts about how to actually do that. How do we actually make sure that that is a founding principle of the panel? Perhaps if I could ask Aruka. Oh, there we go.
All right, I'll start, but it's actually a difficult question, and this is why we're all mustering thoughts. I know that when we decided to have the lesson learned workshop in Lagos, we were actually aiming to have more voices from lower middle income countries, and it was actually quite challenging It took us several months to be able to invite and also have the right voices at the table. But then I think that kind of work needs to be done. Very often, rushing through is when you end up with making compromises that don't bring the right voices to the table. There's actually quite a lot of interest and expertise in lower middle income countries, even though it's not that visible. Some of the suggestions that have been made in multiple venues, including Matthew's paper at the Lessons Learned workshop in Lagos, is that although we would like most of the activity on the panel to be done on a volunteer basis, it's easier to volunteer when you have excess resources. And so we might have to think about how to compensate people who are coming from countries that are low income, who earn less, so that they can be relieved to be able to participate. The other thing is the importance of engaging the youth. When you look at my generation and above, it's very easy to look at, publication histories and pull people out. And when you do that, you tend to have a less balanced group because some people have had greater opportunities to publish. But I think if we look at youth, then we can be very equitable in terms of how we draw those voices and also draw voices that will be more future thinking. Those are just a couple of suggestions, and I'd love to have other people weigh in.
John Young, I believe you got your hand up.
Yeah, I think this is really a very important point, and we have also embedded the consideration into as you may have seen that in the zero drafts. I think this is the equitable participation is not like it's first you can see that it's in the different membership. We really emphasize the cross-sectorial regional balances, etc., which this will be reflected in the rules of procedure. The other thing is that also, I think also Iruka mentioned a lot of really important points, is that also if you look at the function of the plenary is that this one is about how to support the equitable participation. This is also a very important role function in the secretariat is how to support the developing world and the global south, the underrepresented voices to participate in this process. This will also be translated in the other rules and procedure documents just to make sure that like when doing the nominations of experts that it will hear from the wide community and also select like really to make sure that all the voices are represented. I think this has been a very core success component of other science policy panels, and we can learn a lot from them as well. Thank you.
Rosie, I believe you had your hand up. Did you want to come in on that point?
Yeah, I know we are nearing time. Just a quick comment. As long as the panel has legitimacy and an agreement from the member states, and there is openness to dialogue and respect for different sectors and for different opinions, as they say, that is, I think, what is going to be essential for scientists to come up and talk and respond to the challenge, as well as for policymakers to sit and listen. And these scientists will come from across continents and have solutions that are tailored for their context. And they need that space to talk without being judged and to move forward in the context that they work. So it's going to be a process, but I think that open sharing and learning space is what is essential for this IPA to create. Thank you.
Amazing, thank you. And I think that's a wonderful note to end on. I'm afraid that's all we have time for today, a very rich discussion. I'd like to thank our panelists once again, all of you who joined the session, and a massive thank you to the team at ISMID and Global Strategy Lab who made it all happen. A reminder that the consultation process is live, so do engage in the coming weeks, and thank you all again.